Now, I am chairing this steering committee command center. We've had 4 meetings in the past week. We've announced a series of measures for prevention and control of the disease. Yesterday, the Chief Secretary for Administration met with the media to give you an update on the supply of face masks. Today, at the press conference, we will report on several issues. First of all, the World Health Organization announced last night or early morning Hong Kong time that they made a statement on the latest update on this novel coronavirus. Now, perhaps I will highlight on parts of the statement relevant to Hong Kong. And then secondly, we're going to report to you on the progress of implementation on the announced measures. And thirdly, we will report on our further prevention and control actions. First of all, on the World Health Organization statement, they have taken on board the recommendations of the emergency meeting. First of all, the WHO welcomed the effort made by the People's Republic of China on to control and prevent the disease, and it is a matter of international health. This constitutes a public health emergency of international concern, and if I may point out in the statement, they say that they have decisive and resolute measures should be taken. Then they will prevent the spread and control the disease. So as long as we take such measures and then we track all those involved and so on, and take all necessary measures, it will help to stop the spread of the issues. But then there are, of course, constant changes in relation to the epidemic, and then there is a need to make corresponding adjustments to the measures. As you might recall, in the past week, we've been closely monitoring the latest issue and in making the necessary adjustments. This week, we have announced 8 measures in response, and then we have looked at each of these measures and then we try to compare it with what is said in the statement and find that most of the measures match those suggested by WHO. Of course, there are certain areas where we could do even better. Now, in fact, we have adopted some of the measures before the WHO made such suggestions. For example, early detection, isolation, management of cases, tracking, and so on. We will have regard to the recommendations made by the WHO, and it will take concrete measures, including that at international border control there should be exit screening. This is and then we should reduce social contact. We must give better protection to healthcare personnel. And then there must be some better communication. The SAR government will follow closely the suggestions made by the WHO, and then in light of developments, we will make necessary adjustments to measures announced. Now, on the second part, that is the measures that we have taken, I would like to report on the implementation. Now, usually at 4:30, the Hospital Authority and the Department of Health, that is in particular the Center for Health Protection, they would host a press conference at 4:30 to give you the latest update. But of course, this press conference has been replaced by this one today. As at 9 a.m., the Center for Health Protection, they recorded 12 confirmed cases of novel coronavirus infection. And then out of those, 11 cases are imported or related to imported cases. One case is still under investigation. So for that one case under investigation, of course, it will be of great significance. And then 5 of those cases are Hong Kong residents, 7 are mainland residents. As at noon yesterday, 680 cases met the reporting criteria. 478 of those cases have been ruled out to have nothing to do with the coronavirus. As for another 191 cases under observation, they are still in hospital undergoing checks. And then of these cases, 550 involve Hong Kong residents, 130 cases involve non-Hong Kong residents. I understand that tomorrow the hospital authority will be able to carry out the rapid test at the 7 clusters of hospitals. There is no need for them to send all the samples to the Department of Health Center for testing. So with this new testing arrangement, it will help us to speed up the test, and then we could get the results sooner, and then that will help to lessen the burden on healthcare staff. On the 28th of January, we announced a number of measures. They could be grouped into several categories. First type, they would substantially reduce the population mobility between the mainland and Hong Kong. Now, as at yesterday, well, because there are various cross-boundary traffic services, and they've been reduced, and it started yesterday. So yesterday was the 30th of January, and the incubation period is 14 days, so 16 days before yesterday, for all arrivals from the mainland at all the boundary crossing points except the airport. Now, compared to the 14 days ago, the number has dropped by 91%. Yesterday, number of arrivals, mainland residents only accounted for 9.7% of all the arrivals. In other words, most people arriving yesterday were Hong Kong residents returning to Hong Kong. And then we'll continue to implement all the stringent measures. We will manage our boundary crossing points properly. So we believe there will be further reduction in the flow of people between the two places. But we will keep in close liaison with the mainland and see if there is need to consolidate and review the strength of our measures in managing the borders. As WHO said, there is a constant evolution of the disease, and so we will continue to monitor constantly the developments, and on reduction of people flow between Hong Kong and the mainland, we will see what more needs to be done. And here we would like to make an appeal to the public. Unless it's absolutely necessary, please avoid going to places where there's been an outbreak, and of course that includes the mainland. Now, because for Hong Kong residents leaving Hong Kong to go to mainland, of course they will have to come back eventually. Now, during this period, we've seen a substantial reduction of the number of people leaving Hong Kong for the mainland, but the number is still significant. For example, yesterday, on the 30th of January, there were still 37,000 Hong Kong residents leaving these boundary control points. Most of them were heading for the mainland. So that means when they come back, they will bring with them the risks of infection. For the second type of measures announced last week, that involves reducing the mobility within Hong Kong and social contact. That's the social distancing recommendation of the WHO. Now, we following the latest development in of the outbreak, and then we know that there will be a tight supply of protection equipment, including masks. So that's why at this point in time it is even more important to minimize social contact, because if you stay home and you don't go out, you don't need to wear a mask. That's why earlier, we announced that for all schools, primary schools, secondary schools, kindergartens, and special schools, originally they would resume class on the 17th of February. But at that time, we already cautioned that we will have to review the date having regard to the latest developments. Today, we announced that the soonest date of resumption of class would be the 2nd of March, but of course we will have to review it again. Of course, some say that we should delay class resumption indefinitely, but at least we should give a clear indication to schools that is from now until the until the 1st of March, there is no need to go back to school. On the 2nd of March, where this class could resume, we will have to see, as we monitor the developments, the supply of protection equipment and other possible considerations. We will then make a decision and make an announcement. On class suspension, resumption, or on public examination arrangements, the Education Bureau will keep in close touch with school sectors. Now, the Secretary is not here because he still needs to discuss various issues. Next week, the Secretary for Education will meet with the media to explain all the details to the public on our assessment and decision to resume class. As I said, the vectors include the developments of the epidemic, the supply of protection equipment, and so on. So there must be adequate conditions before, that is, we must make sure it's safe before we will resume class, and we will make early announcement. So, in other words, we won't announce today that class will resume tomorrow. So we will give school plenty of time to make preparations. But I must stress that with this class suspension arrangement, we hope that students will stay at home instead of moving around in the community. Otherwise, it will not achieve our objective of minimizing social contact. On work arrangement, the SL government is a major employer. We must, of course, deal with the issue. Earlier on, the government announced the special work arrangement for certain departments, that is after the public holidays of the Chinese New Year, that is starting from the 29th of January, unless there are individuals who need to provide essential or emergency service. Other government employees do not need to go back to the office to work. In other words, they could work from home. And the announcement applied to up till this Saturday, that is this Sunday, that's the 2nd of February. In other words, if everything is safe, then that means on the 3rd of February, everything. Essential and emergency services, there are other services needed by the public. So starting from the 3rd of February, the arrangement in general is that government departments may extend the work from home arrangement that I mentioned just now. But essential and emergency services must be provided. And then today, on top of that, we are announcing that basic and limited services must also be provided. So heads of departments will have regard to their own situation, and then make an announcement as soon as possible. I require them to make an announcement within the next day or two, especially those departments that are in constant contact with the public. So they need to announce early what the arrangement is, what services are considered essential or basic, and what services could be provided in a limited scale. And then for other employees, they could continue to work from home. This arrangement will be in place until next Sunday, that is the 9th of February, because we need to review the arrangement on a weekly basis. For schools, it's different. We need to give more time to schools because we're talking about a large number of students. And also, we need to give enough certainty to schools so they know that they won't be able to resume class for almost a month. But as for full resumption of government services, we will review the arrangement on a weekly basis. And I've also asked the Secretary for Civil Service to consider the views of departments and the latest developments.
即係話提供基本有限度公共服務同埋緊急必須嘅公共服務咧，佢哋嗰個反應係點樣樣？然後就局長會向由我主持嘅督導委員會暨指揮中心咧係作出建議。喺呢度咧，特區政府亦都係呼籲私營企業或者係非政府機構嘅僱主咧，亦都希望佢按住剛才講嘅政策目標。即係話喺呢段咁疫情嚴峻嘅時候咧，大家都要減少社交嘅接觸，減少因為僱員咧要出外要搭公共交通，而可能有感染傳染嘅風險啦，亦都要係因為嗰個物資供應嘅短缺咧，可能係要作出一啲特別嘅安排。總的來說，希望大家都係彈性嚟到處理呢個相關嘅事宜啦。
In summary,
第三類我哋公布嘅措施咧，就有關於加強醫學嘅監測，嚟到去減少傳播嘅風險。喺呢方面咧，將涉及幾類嘅人士啦，包括香港人喺湖北翻嚟，香港人喺內地翻嚟，同埋湖北人喺香港。就係特區政府喺呢度再次呼籲香港嘅居民咧，應該盡快從內地翻嚟香港，亦都翻咗嚟之後，埋家喺香港嘅居民咧，唔應該到有疫情嘅地方。咁所以剛才我提到個數字咧，每日仲有數以萬計嘅香港居民離境到內地或者到其他地方咧，呢個將構成一定嘅傳播疫情嘅風險嘅。針對所有從內地翻香港嘅市民，就除咗喺湖北省啦所有從內地翻香港嘅市民喺條件許可之下，翻香港14天內咧，應該係盡量留喺屋企。如果有需要外出，應該係翻香港14日咧係佩戴口罩。至於喺14日內曾經往湖北省嘅香港居民，入境嘅時候必須聯絡衛生署嘅港口衛生科人員，並喺該人員作出健康評估之後咧，獲安排入住檢疫中心檢查。呢個係加強咗嘅監察嘅措施。即使係未俾該人員作出健康評估之後咧，獲安排發燒嘅咧，都要作出呢個特別嘅進入檢疫中心嘅接受觀察嘅安排，呢個係適用於喺湖北省過去14日喺湖北省而家翻嚟香港嘅。不過相信隨住湖北省喺1月下旬係即係封咗城啦，咁所以個人數應該唔多嘅。但係我哋過去幾日一陣間陳處長可以講下咧，亦都係港口衛生科嘅同事咧係有接觸到幾位香港嘅居民。至於係仍然逗留喺香港嘅嚟自湖北嘅居民，一般都係旅客啦。就因為入境嘅一般係旅客咧，都係俾佢7日逗留。咁所以隨住我哋喺1月27日已經全面限制湖北省嘅居民，同埋14日內曾經喺湖北省逗留嘅人士進入香港境咧，呢個數字係不斷下跌㗎啦，應該就唔多㗎啦。一陣保安局局長可以講下，即係我哋而家估計嘅整體留喺香港嘅湖北嘅省嘅旅客係有幾多？但呢個工作我哋都係唔會鬆懈嘅。由1月29日起，即係2日前呢，入境處就開始陸續巡查香港嘅酒店同賓館，去揾出目前仍然留在香港嘅湖北旅客，記低佢哋聯絡資料，同埋向佢哋提供健康嘅建議。截至到今日1月31日下午1時，入境處咧係一共已經巡查咗355間酒店同埋賓館，一共咧係揾到48名湖北嘅旅客。當中有15人呢已經係自行離開咗香港，衛生署呢係將會安排其餘嘅旅客 入住檢疫中心，或者安排冇病徵嘅旅客咧係盡快離港。呢個亦都係加強嘅措施嚟嘅。咁啊，大家聽到啦，我哋凡係喺湖北省翻嚟嘅香港居民，或者而家留喺香港嘅湖北省嘅旅客咧，如果呢啲湖北省旅客唔自行離開咧，我哋要送去檢疫中心。所以對於檢疫中心嘅需求咧係會有所增加。目前咧，我哋一共有3個檢疫中心，分別係康文署轄下2個度假營啦，即係麥理浩夫人度假村同埋鯉魚門嘅公園度假村，以及保良局賽馬會北潭涌度假營，一共能夠提供咧係90個單位。我哋而家係正進一步去準備更加多嘅檢疫嘅設施。我知道傳媒朋友可能都亦都係好關心而家係喺湖北省嘅香港人嘅情況。稍後我請政制及內地事務局局長聶德權咧同大家交代下最新嘅情況。我上次都提過啦，因為喺揾呢啲地方做檢疫中心出現咗好大嘅困難。咁所以唔排除咧，如果當我哋嘅檢疫中心嘅設施已經不敷應用嘅時候，係要進行加宗嘅隔離。咁所以我哋已經就住呢個要求相關人士喺屋企裏邊進行隔離咧，係做咗一啲嘅準備工作。我哋而家係研究係利用電子追蹤手環同埋定位嘅技術協助進行監測。我哋創科局同埋科學園有關嘅企業咧，已經係做咗一啲嘅研發同埋製造嘅工作。希望下個禮拜咧就已經可以有起碼200套呢啲嘅電子追蹤手環同埋定位嘅儀器咧，可以被需要家中進行隔離嘅人士咧所採用嘅。加強嘅醫學監測嘅措施包括以下2方面嘅。第一就係按住世界衛生組織要求，所有國際嘅旅遊啦，我哋都要加倍小心。咁所以往時比較着重係入境嘅時候嘅監測，佢就建議咧，我哋對於出境亦都要做篩查。咁所以由明日開始，香港國際機場我哋會進行出境同埋過境行人嘅篩查，係體溫嘅檢測。咁如果發現呢啲出境嘅旅客係發燒咧，將會不獲准登記。另一方面咧，就喺陸路口岸嘅方面，我哋亦都係同樣喺明日咧，就會率先喺羅湖口岸同埋深圳灣口岸咧，係實施健康申報制度。喺呢啲陸路口岸已經有體溫嘅檢測嘅工作做緊㗎啦，不過會加強咧作呢個健康申報嘅工作。我而家就先請陳肇始局長同大家講講喺呢個疫情方面嘅最新嘅情況。好啊，多謝行政長官，各位傳媒朋友。